Introduction. What if I told you that 35% of American adults are unknowingly living with a deficiency that's silently sabotaging their immune system, weakening their bones, and potentially triggering depression? And what if the solution might be as simple as stepping outside or taking a single supplement? Welcome back to Rooted Health Revival, the podcast that transforms complex science into life-changing insights. I'm your host, and I want to personally thank each and every one of you who've subscribed, shared our episodes, and trusted us to be part of your wellness journey. Your engagement and feedback continue to inspire us to bring you the most cutting-edge, evidence-based health information available today. Today, we're diving deep into one of the most misunderstood yet crucial nutrients for human health, vitamin D3, often called the sunshine vitamin. Whether you're a busy professional in New York, a parent in London, or a fitness enthusiast in Berlin, this episode will revolutionize how you think about this extraordinary nutrient and its profound impact on your daily life. Part 1, the vitamin D crisis. Understanding the hidden epidemic. Let's start with a startling reality check. According to the Cleveland Clinic's comprehensive research, 35% of adults in the United States are clinically deficient in vitamin D. But here's what's even more concerning. Many more people are getting some vitamin D, but still far less than their bodies actually need for optimal function. This isn't just an American problem. Across Western Europe, vitamin D deficiency rates are equally alarming, particularly in countries with limited sunlight exposure during winter months. The United Kingdom, Scandinavia, and northern regions of Germany face some of the highest deficiency rates globally. But why should you care about these statistics? Because vitamin D deficiency is what I call a silent saboteur. Its symptoms are often so vague that they're easily overlooked or attributed to other causes. Heather Mangieri, a registered dietitian nutritionist and sports nutrition expert in Pittsburgh, explains this perfectly. Most symptoms are vague and can be easily overlooked. As a sports dietitian, I get concerned about a vitamin D deficiency when I see an athlete complaining of fatigue, bone pain, muscle aches, or presenting with multiple bone fractures or injuries. Think about your own life for a moment. Have you experienced unexplained fatigue that doesn't improve with rest? Mysterious muscle weakness that seems to come and go? Bone pain that your doctor can't quite explain? Changes in your mood, particularly during darker months? These could all be signals from your body that you're not getting enough of this crucial nutrient. The symptoms extend beyond what Mangieri mentioned. Research has documented that vitamin D deficiency can manifest as persistent muscle weakness that affects daily activities, mood changes, and increased susceptibility to depression, frequent infections as your immune system struggles, bone pain that seems to have no clear cause, dental problems, and slower healing. What makes this particularly insidious is that these symptoms develop gradually. Your body is remarkably adaptable, so you might not notice the slow decline in energy, the gradual weakening of your immune system, or the subtle changes in your mood until the deficiency becomes severe. The economic impact is staggering too. Healthcare costs related to vitamin D deficiency run into billions annually across developed nations, from increased hospitalizations for fractures in elderly populations to lost productivity due to frequent illnesses and chronic fatigue. But here's the empowering news. Unlike many health conditions that require complex interventions, vitamin D deficiency is entirely preventable and reversible. Understanding this nutrient is your first step toward reclaiming your energy, strengthening your bones, and optimizing your overall health. Part 2, the science behind vitamin D3. How this remarkable nutrient transforms your body. Now let's dive into the fascinating science of how vitamin D3 actually works in your body. This isn't just academic knowledge. Understanding these mechanisms will help you make informed decisions about your health. First, it's crucial to understand that there are two main types of vitamin D2 and vitamin D3. According to Harvard T.H. Chan School of Public Health, vitamin D2 occurs naturally in some plants, while vitamin D3 is found in certain animals and remarkably is produced by your own skin when exposed to sunlight. But here's where it gets interesting. Not all vitamin is created equal. Mangieri explains that D3 is considered the more potent form because it has been shown to raise levels higher and for a longer period of time than D2. This means that when you're choosing between supplements or focusing on natural sources, vitamin D3 gives you more bang for your buck. Melissa Prest, a doctor of clinical nutrition and registered dietitian nutritionist with kidney nutrition specialist in Seattle, Washington, provides crucial insight into how this nutrient functions. Vitamin D is a fast-soluble vitamin that is both a nutrient and acts as a hormone. This dual nature is what makes vitamin D so uniquely powerful in your body. Let me break down the primary mechanisms. Calcium and phosphorus regulation. Vitamin D3's main job is helping your body absorb and regulate calcium and phosphorus. These minerals are the building blocks of strong bones and teeth. Without adequate vitamin D3, your body can only absorb about 10 to 15% of dietary calcium. With sufficient D3, that absorption rate jumps to 30 to 40%. This isn't just about preventing osteoporosis in old age. This is about maintaining bone density and strength throughout your entire life. Magnesium absorption. D3 also enhances magnesium absorption, which supports muscle function, nerve transmission, and energy production at the cellular level. This explains why vitamin D deficiency often manifests as muscle weakness and fatigue. Immune system modulation. Perhaps one of the most exciting discoveries in recent vitamin D research is its role in immune function. D3 boosts your immune system by inhibiting the production of inflammatory cytokines, molecules that signal inflammation throughout your body. This means vitamin D3 acts as a natural anti-inflammatory agent, helping your body maintain the delicate balance between fighting off threats and avoiding harmful overreactions. Hormonal functions. As a hormone, vitamin D3 influences the expression of over 1,000 genes in your body. It has receptors in virtually every tissue, from your brain to your muscles to your immune cells. This widespread influence explains why vitamin D deficiency can affect so many different aspects of your health. The conversion process is equally fascinating. When your skin is exposed to UVB radiation from sunlight, it converts 7-dehydrocholesterol to pre-vitamin D3, which then becomes vitamin D3. This D3 travels to your liver, where it's converted to 25-hydroxy-vitamin D3, and then to your kidneys for final activation into the hormone calcitriol. This complex process explains why simply taking a vitamin D supplement isn't always enough. Your liver and kidneys need to be functioning well, and your body needs adequate magnesium and vitamin K2 to optimize vitamin D3 utilization. The research continues to evolve, with scientists investigating vitamin D3's role in heart disease prevention, diabetes management, depression treatment, and even multiple sclerosis therapy. What we're discovering is that adequate vitamin D3 levels may be one of the most fundamental requirements for optimal human health. Part 3. The life-changing benefits. How vitamin D3 transforms your health. The health benefits of maintaining optimal vitamin D3 levels are nothing short of remarkable. Let's explore each major benefit with the scientific evidence that supports it, so you understand exactly why this nutrient deserves a central place in your health strategy. Unbreakable bones, your foundation for life. Strong bones aren't just important for elderly people. They're crucial for everyone who wants to live an active, independent life. Prest explains that vitamin D deficiency, especially as we age, dramatically increases fracture risk and leads to weak, soft bones. When deficiency becomes severe, it causes a condition called osteomalacia. This isn't just academic terminology. Osteomalacia can cause bone deformities, chronic pain, seizures from low blood calcium levels, muscle spasms, and dental abnormalities that affect your quality of life every single day. A comprehensive review published in the International Molecular Sciences found that vitamin D deficiency doesn't just cause osteomalacia, it significantly increases your risk of developing osteoporosis, the brittle bone disease that affects millions worldwide. The research shows that adequate vitamin D3 levels can reduce fracture risk by up to 20% in older adults. But this isn't just about aging gracefully. If you're physically active, play sports, or simply want to maintain your independence as you age, strong bones are your foundation. Every step you take, every weight you lift, every dance you dance depends on the structural integrity that vitamin D3 helps maintain. Immune system mastery, your internal defense force. Your immune system is your body's sophisticated defense network, and vitamin D3 is like the commander that keeps everything running smoothly. Due to its ability to regulate inflammatory cytokine production, vitamin has proven effectiveness in helping your immune system overcome bacterial and viral infections. The research is compelling. Studies have shown that adequate vitamin D levels can help your body fight off infections ranging from common pneumonia to COVID-19. According to research published in the journal Nutrients, data consistently links vitamin D deficiency to defective immune system functioning, increased infection risk, and a predisposition to developing autoimmune diseases. Think about this practically. How often do you get sick? How quickly do you recover? How well do you feel during cold and flu season? Your vitamin D3 status might be the missing piece in your immune health puzzle. The anti-inflammatory properties are particularly important in our modern world, where chronic inflammation is linked to everything from heart disease to cancer to accelerated aging. By maintaining optimal D3 levels, you're essentially giving your body a natural tool to manage inflammation more effectively. Cardiovascular excellence, protecting your heart. Your heart and cardiovascular system benefit tremendously from adequate vitamin D3 levels. The research consistently shows associations between vitamin D deficiency and heart disease, as well as increased cardiovascular disease-related mortality. Researchers writing in Clinical Nutrition explained that vitamin D helps regulate blood pressure and acts on several mechanisms that keep heart disease risk low. While studies haven't yet found explicit benefits from high-dose vitamin D supplementation for preventing cardiovascular events like heart attacks, according to the National Heart, Lung, and Blood Institute, experts emphasize the importance of maintaining recommended daily levels. Consider this. Heart disease remains the leading cause of death in developed countries. While vitamin D3 isn't a magic bullet, ensuring adequate levels is a simple, low-risk intervention that supports your cardiovascular health alongside other healthy lifestyle choices. Mental wellness, the mood connection. The relationship between vitamin D3 and mental health is one of the most exciting areas of current research. Low vitamin D levels have been scientifically linked to depression, and vitamin D supplements are increasingly used as part of depression treatment protocols. A significant 2022 review published in Frontiers in Public Health analyzed multiple studies and found that vitamin D supplementation reduced the incidence of depression and improved treatment outcomes, especially for women and people who were previously deficient in the vitamin. This makes intuitive sense when you consider that vitamin D production is triggered by sunlight exposure, and we know that seasonal affective disorder, SAD, is more common in regions with limited sunlight. But the connection goes deeper than just seasonal changes. Vitamin D receptors are found throughout the brain, and the nutrient plays a role in neurotransmitter synthesis and brain function. Muscle power, strength that lasts. Recent research is revealing exciting connections between vitamin D3 and muscle health.
A study published in the journal Metabolism found that people who took vitamin D had increased muscle mass and muscle strength compared to a control group. The researchers believe that vitamin D helps regulate protein synthesis and blocks the pathways that lead to sarcopenia, age-related muscle loss. This is crucial information, whether you're a young athlete looking for optimum performance or someone wanting to maintain strength and independence throughout life.
Part 4. Your Action Plan. Mastering Vitamin D3 for Optimal Health. Now that you understand the science and benefits, let's create your practical action plan for optimizing vitamin D3 levels. There are 3 primary ways to get vitamin D: from food, from the sun, and from supplements. Let's explore each option so you can create a strategy that works for your lifestyle and circumstances. Food sources, the natural approach. Mangieri emphasizes that fatty fish like salmon, tuna, mackerel, and trout, as well as fish liver oils, are among the best natural sources of vitamin D, including D3. If you enjoy seafood, incorporating these fish into your diet 2 to 3 times per week can contribute significantly to your vitamin D intake. Other food sources include egg yolks from pasture-raised hens, fortified dairy products and plant-based milk alternatives, fortified cereals and nutritional yeast, beef liver and other organ meats, mushrooms exposed to UV light. However, Prest is honest about the limitations. It is difficult to get enough vitamin D from foods alone. We need to consume vitamin D and get some exposure to the sun to make sure we have an adequate supply available for our body to use. Sunlight exposure, the original source. Your skin is remarkably efficient at producing vitamin D3 when exposed to UVB radiation from sunlight. However, this natural process is more complex than simply getting some sun. Mangieri explains the multiple factors that affect your body's ability to produce vitamin D, such as cloud coverage, season, distance from the equator, pollution, skin pigmentation, age, and wearing sunblock can all impact how much vitamin D your body is able to produce. Here's a practical guide for safe sun exposure. Timing. The optimal time is between 10 a.m. and 2 p.m. when UVB rays are strongest. Duration. Fair-skinned individuals may need only 10 to 15 minutes, while darker-skinned individuals may need 30 to 60 minutes. Skin area. Exposing arms, legs, and torso is more effective than just face and hands. Frequency. Several times per week is more beneficial than occasional long exposures. However, you must balance vitamin D production with skin cancer risk. The danger of excessive UV exposure is real, which is why many experts recommend a combination approach rather than relying solely on sun exposure. Supplementation, the reliable solution. Given the challenges with food sources and sun exposure, Mangieri acknowledges that when it comes to vitamin D, a dietary supplement is often needed. The National Institutes of Health recommends daily vitamin D intake for children and adults of 600 to 800 international units, IU. However, many functional medicine practitioners suggest higher doses may be beneficial for individuals with deficiency or those at higher risk. This is why professional guidance is crucial.
Choosing the right supplement. You can get both vitamin D2 and vitamin D3 in supplement form, but remember that D3 is more potent and longer lasting. Prest explains that vitamin D2 supplements are made by exposing ergosterol in yeast to UV radiation, while vitamin D3 supplements traditionally come from lanolin in sheep's wool exposed to UV radiation. For those following plant-based diets, there's good news. There is also an animal-free version of vitamin D3 made from lichen, Prest notes. This lichen-derived D3 comes from algae and is just as effective as animal-derived versions. Quality matters. Since vitamins and supplements aren't FDA regulated, choosing high-quality products is essential. Prest recommends looking for standalone vitamin D supplements rather than multivitamins to ensure adequate dosing. Mangary advises look for brands with the USP verification mark on the label or that have been third-party tested through programs like NSF Certified for Sport or Informed Choice. By choosing supplements with these labels, you know that what is on the label is actually present in the product in the amounts stated. Creating your personal strategy. Your optimal vitamin D3 strategy should consider your geographic location and seasonal sunlight availability, your skin tone and sun sensitivity, your dietary preferences and restrictions, your current health status and any medications, your lifestyle and schedule constraints. Most importantly, Mangary emphasizes having a conversation with your doctor or registered dietitian before starting supplementation. A healthcare professional can help determine your current vitamin D status through blood testing and recommend appropriate dosing based on your individual needs. Monitoring and adjustment. The gold standard for assessing vitamin D status is a blood test measuring 25-hydroxyvitamin D levels. Optimal levels are generally considered to be between 30 to 50 ng per ml, 75 to 125 nm per ml, though some experts argue for higher targets. Regular monitoring allows you to adjust your strategy and ensure you're maintaining optimal levels year-round, not just during sunny seasons.
Conclusion and call to action. As we wrap up this comprehensive journey through the world of vitamin D3, I want you to take a moment to reflect on everything we've covered today. We've explored how this remarkable nutrient acts as both a vitamin and a hormone in your body, influencing everything from bone strength to immune function, from cardiovascular health to mental wellness. The research is clear. Adequate vitamin D3 levels are not optional for optimal health. They're essential. Whether you're dealing with unexplained fatigue, frequent infections, mood changes, or simply want to optimize your health and longevity, addressing your vitamin D status could be one of the most impactful steps you take this year. Your action steps starting today. Consider getting your vitamin D blood levels tested to know where you currently stand. Evaluate your current sun exposure, diet, and supplementation strategy. Consult with the healthcare provider about the right approach for your individual needs. Implement a consistent plan that combines safe sun exposure, vitamin D-rich foods, and high-quality supplementation as needed. I want to express my heartfelt gratitude to each of you for investing your valuable time in learning about this crucial aspect of health. Your commitment to understanding and improving your wellness is inspiring, and it's an honor to be part of your health journey. If today's episode provided value for you, I have a small favor to ask. Please take just 30 seconds to subscribe to our podcast if you haven't already, and consider sharing this episode with someone in your life who might benefit from this information. Whether it's a family member dealing with unexplained fatigue, a friend who's frequently getting sick, or a colleague who's curious about natural health optimization, your share could be the catalyst for positive change in their life. We love hearing from our community, so please leave a comment or review sharing your thoughts on today's episode or telling us what health topics you'd like us to explore next. Your feedback directly influences the content we create, ensuring we're always bringing you the most relevant and valuable information. Important medical disclaimer. The content shared in today's podcast is for educational purposes only and does not replace professional medical advice. Before making any significant changes to your supplement routine or health strategy, please consult with qualified healthcare professionals who can assess your individual situation and provide personalized recommendations. Until next time, remember, small, consistent actions in pursuit of optimal health create extraordinary results over time. Start with vitamin D3, but don't stop there. Your future self will thank you for every positive choice you make today. This is Health Revolution, and I'm your host, reminding you that your health is your most valuable asset. Invest in it wisely, protect it fiercely, and never underestimate the power of knowledge to transform your life. Stay healthy, stay curious, and we'll see you next time.